Hello, this is Dr. Gay from First Light MRI, and this is a 60-year-old male with complaints of locking, pain, and stiffness in the third and fourth fingers. When he flexes his fingers, they become tight and trapped, and this is a case of trigger finger. And so trigger finger is inflammation of the tendon sheath, and on this view, this is a short axis view where we see the flexor tendons over here in the palm. This is the second, third, fourth, fifth fingers. The extensor tendons are over here, the flexor tendons are here, and the flexor tendons are paired. We have a deep and superficial. So it's called the profundus, and this is the superficialis, the flexor digitorum tendons. And here they look morphologically normal. They're not thick. There's no nodularity. Over time, tenosynovitis can cause thickening and a little nodularity of the tendon, but here we don't see that. It looks morphologically normal. We really don't see the inflammation here because this is not sensitive to fluid, but if we put up a stir sequence as sensitive fluid, we see clearly that there is abnormality surrounding the flexor tendon here. So this is around the metacarpal phalangeal joint. This is a band of inflammation in the deep soft tissues surrounding this flexor tendon. And if we go to this view here, we see the whole tendon sheath is thickened, inflamed edematous, and this is constricting the flexor tendons here. So this is a case of stenosing tenosynovitis, a classic case. We can see this on another view. This is called a coronal stir view. We can see all the fingers here at the same time. If I zoom back, this is the second, third, fourth, fifth digits. And on this view, we can see the halo of inflammation. That flexor tendon sheath is thickened, inflamed, edematous on that view. So the trigger finger, or stenosing tenosynovitis, is what we call this. And again, this inflammation of that tendon sheath that restricts or constricts the flexor tendons. It makes it catch, and sometimes it can lock the finger in flexion. And when that happens, if it's mild, they can put the patient in a splint or just have them rest, give them non-steroidal anti-inflammatories, and it may calm the inflammation. It can heal. If it's pretty bad, they have thickening of the tendon. The tendons become thickened because of the chronic pressure. They can develop little nodules, and then it's more severe, and it just leads to more inflammation. When it's more severe, they may need to do a steroid injection where they go in and inject the tendon sheath, try to calm the inflammation, or sometimes they have to manipulate it where they put a needle in there and move the finger around and try to break up the adhesions. And then the more severe cases, they have to go in and do a release where they'll go in there and just open up the tendon sheath to give it room, and again, in just severe cases. So this is a case of stenosing tenosynovitis. This is inflammation of that flexor tendon sheath that's constricting the flexor tendons. And this can be seen in people who have hobbies or jobs where they have to do heavy gripping, and they get the inflammation here of the tendon sheath. Patients who are diabetic or have rheumatoid arthritis are more likely to develop this. It's more common in females. This just happens to be a male. And sometimes people who have had carpal tunnel surgery can develop this in the first few months after the surgery. So a case of trigger finger or stenosing tenosynovitis of the fourth flexor tendon.